Hello, everyone. My name is Ann Ballantyne, and I'm Vice President of Marketing and Communications for Rogers Behavioral Health. We are so glad that you are able to join us for our Facebook Live Q&A today. And we are very fortunate to have Rogers' own Dr. Amanda Heins, who is an expert in anxiety. She's also a mom of two school-age children, so perfectly suited to this topic. And she's going to walk us through anxiety as it relates to kids returning to school during a pandemic. This is always an anxious time, and now you add a pandemic on it, and help us through what parents and also educators can do to help kids manage their symptoms. One other note, we'll be taking your questions later, so be sure to leave any questions in the comment section and we'll be answering those later. So, Dr. Hines, thank you so much for being here. And anxiety, tough issues for kids these days.
Absolutely. Yes. Thank you for having me. It is very much like you said, that time of year with just natural worries about an anticipation of a new school year, but then adding COVID-19 on top of all of that adds certainly another element. So very excited to talk through a little bit more in depth with you today.
Absolutely. Thank you. So we'll get started with some questions and just a reminder to leave a comment with your own questions. And we have some of our own for Dr. Hines. We know that there are constant studies coming out, and a recent study was pretty alarming that children's mental health during the pandemic shows that 1 in 5 youth around the globe have increased signs of anxiety. Can you expand on this stat? Is that what you're seeing in your network and here at Rogers? Have you seen a trend in this during COVID?
Yeah, so the study that you're referring to that was published, I think, earlier this month from the Journal of American Medical Association, the pediatrics specifically, I think, and that I think is one of many journals. But yes, they're compared to anxiety rates pre-pandemic. There has been consistent trends to note anxiety has been going up within our youth. And when we take a moment to really reflect on the why, I think many people can naturally make some conclusions even without doing a scientific study. There's been a lot of our world has changed quite a bit in some ways. And there's certainly been ripple effects from COVID-19. And from a child and adolescent standpoint, areas or aspects that's affected most has, really been socialization. Socialization can look very different for some. There could be, and for others, it may not look very different. And so I think that also that variability as well can be really tricky for kids. But it has, changed, maybe potentially how we've navigated sports or school dances or graduation ceremonies or other things that perhaps, kids and adolescents have understandably been looking forward to now looks a little bit different potentially for them. Um,
Sure.
so those are just a couple aspects, but there definitely has been a lot of different ways that COVID has affected I guess the child's world, which naturally can evoke more anxiety.
So for many kids, this is the first day of school, or it's tomorrow, or early next week, and it's normal to have some butterflies and feel a little anxious. What can you talk about the difference between feeling anxious and actually having an anxiety disorder, and how do parents figure out the difference?
Sure. Yeah, that's a great question. And so remembering for all of us that anxiety is an emotion. It's a normal emotion that each of us have, and it is important. It's an important emotion to have. And it's something that we all experience. It's usually in response to something that's stressful. It's not dangerous. It usually will pass just with the simple passage of time. But it can be uncomfortable in the moment when we experience that anxious feeling. But it doesn't last forever. And so when anxiety can become a problem is when our stress response is essentially getting confused. It believes that there's an actual danger or threat in front of me where it's actually not truly a threat. And so if that gets activated too much, we start to perceive something that's typically not dangerous as something that could be dangerous. And that anxiety response kicks in more often. So typically, if you're feeling an increased level of anxiousness before the school year, that's normal. I think the first day jitters, that's very common. Those natural what if thoughts, what if I forget my lunch, or what if I don't have a place to sit on the bus next to my friend? Those are common, automatic thoughts that kids can have, when they're getting ready for their new routine. But usually after we talk those, through, okay, well, what could you do? They okay, that, yeah, I could do that. And they move forward.
Sure.
So
The other thing is there are several different kinds of anxiety. One may not look much like the other. Can you kind of walk us through the different types of anxiety and what some of the symptoms are?
yeah, sure. So briefly, some of the more common forms of anxiety that we can see are social anxiety. So someone who maybe is particularly anxious in social situations, especially having fear related to being negatively evaluated in some way, but the fear is so excessive that they are avoiding social situations. Generalized anxiety disorder is another common form of anxiety, and that is really summed up by what if worries. So there's constant what if thoughts that are coming in and out throughout the day, and we're worrying about everything and anything, and it really has expanded to affect my day-to-day functioning as a result. There's also specific phobias that we can have a fear or become anxious when I see a spider, for example, or heights, or things along those lines. There's also a panic disorder where at times we can experience unexpected panic attacks, and maybe having a fear of or worry of, will I have another one? So that can be common as well. And then last but certainly not least is OCD as well. While it's not formally under an anxiety disorder, it frequently is experienced. Anxiety is a very common component of OCD as well.
Linking, sure. And the other separation anxiety with parents and children, especially at this point in the year, after spending
Yes.
so much time at home together over the summer or maybe even longer. Is that
Yes,
something that
separation
comes into
anxiety,
play?
absolutely.
Hmm. Yeah.
Yes.
And so tell us a little bit about, um, do we navigate these differently as parents? What are some of the best steps to take if parents are worried that their kids may have one of these?
Well, I guess the first step I would do is, try, seek to understand, so sitting down with your child in a way that makes sense, so if we're maybe 4 or 5 years old, getting down on the floor and playing with them, and maybe, asking questions through characters versus, a conversation like you and I are having right now.
Hmm,
Um,
interesting.
just to get on their level a little bit more. But try to understand from their perspective, share what you're noticing and see what they think about that. I'm noticing, as we start to talk more about school, that you've been, a little bit more closed off. You've been maybe avoiding contacting friends, or just whatever those observations may be, and see what your child's thoughts are about that. Because perhaps it could be what we think it is, but perhaps it could not be. Like, Mom, I've been busy. I'm getting my wardrobe ready, or who knows.
Sure.
But
Yeah. And is there anything that parents should try to avoid when they're talking with their kids about these anxious feelings?
Um, I think the first part really is, like I said, just getting information from your child. And so
Hmm.
trying to understand, what are those, if there are worries, let's talk about those. And that way, once we know what the worries are, whether it's related to more typical, first day jitters, and navigating a new building, or a new teacher, or seeing classmates, again, or a change in my learning. Perhaps I was virtual last year and now I'm in person. So depending on what transitions, there's lots of different possibilities. And so once we know a little bit more of what are the worries that they're having, then we can figure out how we can support them.
Mm.
Um, I think the biggest thing to answer your question, Anne, would be to be careful not to jump to solutions right away. As parents, we are fixers. We want to fix it and make it better because then we feel better too. And sometimes we can't quite jump there right away. We first have to understand what's going on and what do they need from us, because depending on the age of the child, it could look very different.
Sure. So once you understand a little bit, some people might be tempted to kind of dismiss the feelings and say, "Oh, that's not a concern. That's ridiculous. Just kind of that suck it up and get on with your day attitude." Others might bend over backwards, as you said, to say, "Oh, you're not feeling well. Why don't you just stay home today?" or whatever. Those are maybe two different extremes. Is there a way to make kids or help kids understand that some of this is normal
Mm-hmm.
and that, are you talk to us a little bit about that idea of validation
Yeah,
that
absolutely. I think that's important, because regardless of our feelings of what our child is sharing, I think it's certainly important to validate their emotions that they're experiencing. And so, even something as simple as, thank you so much for sharing. That makes a lot of sense why you're feeling anxious, after sharing those things with me. So now that we know what it is, let's talk about what are your thoughts about how to navigate this? Like, what have you tried so far? And so it gives the child, again, depending on the age range, gives the child an opportunity to feel heard, but
Mhm,
also then here's what I've been trying so far. And it gives you a chance to assess, okay, do they got it? Do I need to
mhm.
intervene? Kind of where are we with navigating anxiety?
Sure. And parents and schools can really be partners in this too. They
Absolutely.
almost need to be on the same page and helping kids manage. What would you suggest that parents do, knowing that our educators are probably all in school right now? Maybe they're listening later to the recording, right? But how can they work together?
Yeah, so I guess if as a parent, if you're as after talking with your child and your child is expressing some concerns or worries about transitioning back into school, maybe again depending on what it could be related to, perhaps putting it on the teacher's radar of just a heads up. This is what my child was expressing. This is what we're doing at home to help prepare. Just wanted to make you aware, and kind of keep opening that communication line, just
Mhm.
so everyone's on the same page. Um, that way the teacher knows, or at least can have it on their radar of,
Sure.
but not necessarily maybe needing to intervene perhaps right away.
So, are there any tools that you would suggest that parents can work with kids to overcome anxiety or at least calm some of the symptoms?
Yeah, so there's quite a few. Our website, Rogers BH, there's a blog, and within there it specifically talks about anxiety in schools, I believe, and
Hmm.
there's a lot of really wonderful worksheets and activity suggestions, and so that would be another great place to check as well. I can certainly speak to a couple of those here today, though.
Sure.
I think some of the more common techniques, if we're looking for strategies related to helping kind of calm my child in the moment, if they're starting to feel overwhelmed, I'm at school, let's say, and I'm starting to feel overwhelmed with some anxious thoughts. These are a couple of things that you can certainly try with your child. One
Okay.
could be a simple, it's called dialectics, but it's adding the word and. So Why we add the word and is it helps to balance our thoughts. So for example, if I have the thought, I'm feeling I can't do this. This is too hard. That's my thought, perhaps. If I
Mhm.
add the word and, I can try to add another element to my sentence of this is really hard and I don't know if I can do it, and I'm gonna give it a try.
I
And
love
so
it.
at least it offers a little bit more balanced thinking versus sometimes if we get in that negative thinking trap, it can really cloud our kind of our filter, which isn't helpful when we're feeling anxious or stressed. So
So
sometimes that can be helpful.
mhm. So when the parent and child talk through this kind of thing, and the kid understands this, then maybe the parent just says "and" as a cue
Hmm.
for the for the
Yeah.
student to jump in with something. We have many, many more questions, but we're starting to get some great questions and comments. So I want to jump into a couple of those. One parent says, my child suffers from anxiety and it's her first year of high school, which is, a challenge, has no friends, and is intimidated by other students. What can she do?
That's a really great question. And I guess the that transition, obviously, in from middle school into high school, I'm sure we all can remember that.
Hmm.
That's a big adjustment, and so normalizing those worries, and just that that it's very common to have some anxiousness or worry feelings about that change. The other element, too, is as much as we can, trying to help them prepare and practice, so many times transitions, especially going from middle school to high school, can be a great time to, get to know new people. And so practicing with your child, what are ways to get to know someone? How do you introduce yourself to someone? And
Mm,
while many times, by kids in middle school and high school, most are well aware of what those social cues are, and it's amazing in the moment though when we feel really anxious how it can kind of fog our thoughts up, and we can forget. And so practicing those, how do you introduce yourself, what could be a couple things you could ask somebody new that you're meeting for the first time, and then even talking about what are some worries that you have about if you introduce yourself and they say what. So that way your child can say, well, I'm worried if I say, hey, I'm so and so, what's your name? They won't answer me, or they walk away. Okay, let's talk about those. What if that does happen? What can you do? So that way it helps them feel a little bit more prepared. Um,
hmm. Kind
can
of what's the worst that could happen kind of thing, and
exactly. Yeah.
understanding that.
Yeah.
Do you ever recommend that kids kind of own it and say, "Hey, I'm a little nervous," or school first week of school is a little anxiety producing for me," depending on the age?
Sometimes, yeah, sometimes that could make sense.
Mhm.
Because especially within the first week of school, if someone says they don't feel any anxiety
Yeah,
whatsoever in the first week of school, I would love to meet them.
sure. They're
Because it's
probably,
there's just a lot of
not.
change happening and
Yeah.
navigating your new schedule and where's my locker again, and what time is lunch, and there's so many different new things. So that could be a place to have some common ground, certainly.
Okay. We have another question. Excellent question. We've had this back and forth between virtual and in person. And so this parent says, because of the anxiety around in person school, we're doing virtual, but it's not the optimal way for this child to learn. He also struggles with motivation now. So
Yeah.
that causes more anxiety. It's like a vicious cycle. So do you have any tips for this? She adds, or he or she adds, his anxiety causes actual physical issues, even if he doesn't feel the feeling of anxiety. And he uses coping skills, but because his body has a reaction when he gets to where he wants to go, he won't go out in public right now. So
Hmm.
that's hard to use the coping skills. Sounds challenging.
Yeah, no, and I'm glad that you're listening today too. And I believe honestly, when I'm talking to other parents, this is a fairly common transition when you're, whether I'm virtual currently and going back into school, or I was in person and now I'm transitioning to virtual. When being virtual, there are certainly pros and cons. And I think the piece that's being highlighted sometimes is that connectivity component. And so I guess a couple different thoughts I have just related to what can I do if I'm, when I'm anxious and still trying to keep that motivation. I think trying as much as we can to stay connected, whether again in person or virtual, but staying as connected as we can with social supports. So peer connectivity, even if I'm not doing any face-to-face interaction right now, trying to set up as many virtual get-togethers as I can with, maybe those that they seem to be connecting with.
Hmm.
It helps quite a bit. I know sometimes teachers will also try to create like a lunch room, so to speak, virtually. So that giving the kids more of that traditional lunchtime is, we can have our lunch together, but we're chatting like we would across the lunch table. Trying to set up those kinds of opportunities for kids can be really helpful. Or a recess time, instead of logging off, they can be able to, again, chat a little bit with each other like you would at recess. Yes, we
Hmm.
can't play on the monkey bars together, but we can still talk. Uh,
Yeah. But
so
you mentioned recess, and I was just reflecting that, physical activity sometimes
yes,
gets your motivation going too. And it's
yes.
hard if you're doing a virtual day where you're away from people to go out and play with. How do you recommend people use their off screen time? Is it important to get out and get some exercise?
Absolutely. The school has designed their day, especially for elementary age, middle school, and beyond. It's very intentional. There's reasons why they build
Mm.
in multiple recesses and a lunch specifically away
Hmm.
from the classroom if when possible. So it's important to take a break to detach and get some fresh air and get active. And so certainly there's lots of ways that we can do that creatively. I know, certainly when it gets cold outside and rainy or snowy, it can be a little bit tricky, but the more that we can move around and at least at the bare minimum, move away from the computer, I think that does make a big difference.
Okay, some other excellent questions here. We have a high school counselor asking, are there any tools you recommend for high school counselors? We have limited time with students, but this person is willing to do anything he or she can to help. Any ideas?
Yeah, I would definitely check out that on our Rogers website, the school anxiety page. I think there's a lot of really great handouts and resources there that can be user friendly for middle school, high school, elementary age.
Hmm.
So that would be probably just with the time we have. I'd love to talk forever on them, but I think that would probably be the best spot.
Sure. Very
Um,
good. Right there at rogersbh.org under resources, and you can look anxiety in schools, their podcasts, and all kinds of things. Here's another one. Is it better as a parent to email teachers directly to communicate? Now we're talking about a 16-year-old's anxiety or depression, or do you try to leave it to the student to work with the counselor and teacher? Um,
yeah.
Sometimes a teenager can resent this type of overreach, but parents want to do the right thing. So help these parents through.
Yeah, that's a really, really great question. Very thoughtful too, because I think you hit
Hmm.
it on the head, even with your question, is that, you're trying to encourage and promote independence with your teen. And there are times as a parent that we still do need to step in. And so where is that line in the sand, I think is that question. And to probably answer that, it's going to depend on each your child. And so I guess I would encourage to talk with them about where that line in the sand is essentially of like, so what where's their comfort level with letting, their school counselor know about some of the worries or anxieties that they have, and at what point can we agree that it may make sense for me to just reach out and let them know kind of how you're doing, so that way there's some discussion about what we mutually agree to. And then there's a couple that maybe are non-negotiable, like if there's, for example, if you're noticing multiple absences consecutively that are related to anxiety, or maybe increased I'm getting further and further behind in my assignments, and so it's noticingly like affecting my performance, those kinds of things. There may be criteria that you guys want to maybe establish that when we're seeing this kind of stuff, we do need to take some action.
And certainly when there's ever a safety issue of life
Absolutely.
and death,
Yes,
I think
absolutely.
just sharing as a parent to your child, this is my job to keep you safe,
Yes.
and let's talk about what we can do together. But this is job one for a parent. Along those same
Absolutely.
lines, a little on a heavy question here, but we have a parent worried about my daughter going back and seeing her ex-boyfriend. They were together 2 years, and she was hospitalized recently for suicide attempts. Any advice as this child returns, or this teenager returns to school and faces some challenges?
Yeah, I would probably start off with, again, checking in with them and seeing where, what worries or concerns, or how are they feeling about going back to school.
Mm.
Depending on, what were some of the vulnerabilities that led up to those safety concerns, that led, to going in or, being hospitalized. Those would be really important to be aware of, because those would be, risk factors or red flags, if you will, that if we notice some of those popping up, again, that what can we do proactively, to try to help support
Mhm.
before it would go further, perhaps. So if seeing that individual is a worry for them, is there any planning ahead that we can do? Practicing what may you say or not say when you see that individual in the hallway.
Mhm.
Social media, do I continue to have them linked to my, Facebook or Instagram, or do we kind of cut ties via social media? Is that a healthy thought for me to consider? So I think ultimately goes back to talking with your child and just seeing where they're at, because that's understandably, makes a lot of sense why that would be a worry.
Sure. That's a tough situation. Yes.
Yeah.
So I have a real specific question here, but we'll ask it because I think it gives us a chance to talk about that idea of when do you accommodate a
Hmm.
child's need to or desire to stay home versus go to school. And so this parent says, my son is 16 and has HFA, but is also diagnosed with severe generalized anxiety disorder. The trigger is school or any social outing. Was home last year, did better academically, and then here we are, first day of school today. He was trembling, sick, has a teacher we requested we not have, and they gave it to him anyway. So is it worth doing it and going to school, pushing through, or going to an online situation? It's that idea of, is this just torture? So OCD and ADHD as well. I know you can't diagnose over Facebook Live, but any advice here? And when do you accommodate versus push through?
Yeah, no, that's a really great question. And I think to answer just, I guess, a bigger picture, I think many times when there's anxiety, one of the very common reactions that we have is an urge to avoid, right? And so,
Hmm.
because if I avoid the thing that's making me anxious, I won't, in theory, feel the anxiousness. So it makes sense why I may want to not go or be a part of the thing that's going to make
Sure.
me anxious. However, what tends to happen though is that slippery slope, and I think that's what is being highlighted in the question, is that when I, for example, I don't go to something due to anxiety, it actually is reinforcing the anxiety. The reason I didn't feel anxious is because I didn't go to that thing. But what if I have to go on it tomorrow? It's going to feel even more difficult because
Intense,
there's
sure.
more buildup of the thing coming. And so when we look at how do we take anxiety on, we look at it from like a progressive step by step, or something we call shaping. So gradually working ourselves up to the ultimate goal. So if the ultimate goal is to go in-person full day of school, for some, we may be able to do some coaching, practicing, walking through some scenarios, helping with balanced thinking, and then they're good to go. And for some, we may need to progressively build our tolerance level to, getting through the full day, and being able to manage my anxiety. And so going back to the accommodation component, there can be times where, as long as we're working towards the ultimate goal of being in person, for this example, we may need to talk with school a little bit about here's where we are right now, and here's where we're trying to get. And these are the steps that we would like to take to help my child be able to successfully navigate back into school without having unmanageable levels of anxiety.
Great. Good. And so we've dealt with some older kids here. Let's go to the other end of the spectrum and deal with those little ones, just maybe
Yeah,
kindergarten age. Are there
yeah,
any calming strategies as parents of young kids, preschool, kindergarten?
sure. And this age is a really interesting age, because with for their academic career, they're just getting started, which is really usually a very exciting time period. Preschool and kindergarten can be some of the funnest years that you can
Mhm.
have. And so for them, there is an element of they don't know perhaps any different, of like, it's normal for me to go to school perhaps wearing a mask, for example, or other COVID
Mhm.
guidelines. So it may not be as much of a focus on those kinds of things versus more helping just with the traditional, being apart from my parent for the half a day or a full day. If they're struggling with separating, the good news many times is the teachers, they have so many tricks to navigate these transitions. They are amazing.
Oh,
And so, I think letting your teacher know proactively if possible, where your child's at, if they're nervous about being apart, or if they already are having tears, trying to separate. Sometimes schools are very willing and to practice a little bit or build it up a little bit. So you can maybe come a couple of days before to practice, before the real thing. But they have so many great healthy distraction techniques with play and games that many times after like even a week, many of those kind of worries seem to um, situate themselves.
dissipate a little bit.
Yeah,
This next question is hitting on that very topic. My 5-year-old daughter started out with less anxiety, and now she has a week into school. She was nervous but excited. Now she's feeling overwhelmed with workload. Wow, at 5 years old.
yeah,
Um, Negative interactions with peers and teachers. Any suggestions to help with meltdowns before and after school? 5-year-old.
sure. Well, and I think putting it in perspective too, it is a huge adjustment for kids,
Mm-hmm.
depending on what my socialization has looked like or built up to leading up to school. If I had, been around family and friends, but perhaps I haven't have really been surrounded by 20 other, kids my age at the same time, and leaving my classroom to go to gym and recess, and that's a lot of change that they're trying to navigate. And so I think some of it is, normalizing, some of that it makes sense that this, you're probably going to feel a little bit tired, or kids could come home feeling a little bit more cranky, perhaps at this age, because they're wiped out.
Sure.
And so trying as much as we can to, go back to what we know in terms of getting to bed at a good time. Like you said, exercise, engaging in things that, they enjoy doing after school. Those things can also help too. But it is a big adjustment.
Very good. Now we're going to go up to a few years to a 9-year-old struggling with the anxiety of going back to school. And this one's around taking the bus with lots of intrusive thoughts that throw her off. So she missed school today.
Yeah.
And this parent is looking for suggestions on how to get her to take the bus with less fear and then get through the day, because the parent believes that once she's at school, she has fun and enjoys being there. But how do I get her to go?
Yeah, absolutely. So the first piece I would start with is trying to understand, like, what are those what if worries about the bus? Is it about what if the bus, gets into an accident? What if I don't have a place to sit? What if, so,
Hmm.
just exploring, like, what are those what if thoughts about the bus would be the first step. And once I understand, like, what those what if worries are, then we can decide how we want to tackle them. So whether it's like a worry about, I don't know if I don't, what if I don't know anyone on the bus? Do we know in the neighborhood another student that they enjoy playing with that they could be a bus buddy with?
Hmm.
So, so and so is going to be on the bus and excited to sit with you. If they have a sibling that they is going to be joining them on the bus too, sometimes having that sense of comfort of from an older sibling of, hey, I go on the bus every day and here's what it's like. It's really cool. And, we get to pick our own seat, or whatever the, other things that they can share with their sibling to try to offer a little bit more information.
Sure.
Those things can help a little bit too.
So to this point in our Facebook Live Q&A, we've dealt with what schools and parents can do, but there may be a point where more formal treatment is needed. Can you talk a little bit about what that treatment looks like for kids and the different types of treatment available?
Sure. And so, like you said, it's very common to have some anxiety related to transition. And so, if we're noticing, anxiousness a little bit more heightened over the next month, that you could, very easily be kind of related to this adjustment back to school. If you're noticing symptoms are significantly worsening, so, perhaps I was a couple minutes late, to school the first day or two because I was a little nervous, but now I'm getting to be an hour or 2 hours late, and because I'm feeling more and more panicked, or I'm having an increased severity of my anxiety, or I guess just noticing it's spreading beyond the initial scope. That's usually also a sign that maybe I do
Hmm.
need to reach out for
Okay.
some additional support. Um, so there are ranges of resources available.
And then knowing that sometimes a starting place might be a meeting with a counselor or psychologist, once a week or something like that. But sometimes there's more intense treatment needed. You want to talk a little bit about those
Sure.
levels of care?
Yeah, I would be curious too. I think as if you're, as a parent, if you're kind of contemplating, should I reach out, should I not? I also would be curious from a teacher standpoint, if they are able to, if they're going to school, how are they doing in school? Like, what do you see in school? Because that also sometimes, interestingly, can potentially be very different than what you see at home.
Mm.
So it helps you sometimes get a full picture of what is how our child's navigating throughout the whole day. When it is time, or when you are feeling like, I don't know, I think I'm just going to reach out, when in doubt, please do reach out. Specifically at Rogers, we have a wide range of different services in terms of intensity. There are programs that you could go to that outside of Rogers as well, that have a once a week, checking in with someone, just whether it's age related, usually it could be play versus as they're getting older, more traditional talk therapy. But there are different types of interventions that can be done with specifically with anxiety.
But important, I hear you juxtaposing that patience with understanding, hey, it's normal to see some anxiety in the beginning of the year, but you don't want it to um, bubble up and get to a crisis point because then it is, what's required to treat it is more severe and more intense. So I hear you just encouraging parents to walk that balance. Good.
Absolutely. And yeah, when in doubt, reach out. And I think um, getting some healthy assurance as parents too, like that this is, yep, this makes sense. And here's some strategies, or it sounds like you're doing all that you can do. Just keep it up. Sometimes that can just be all that we need as a parent too, to know, okay, I am doing all the things and this should get better. Our pediatricians as well are great resources that you already are connected to, in theory, and they can help you also kind of decipher, is this something that, I should reach out to, a mental health professional about, or is this something that you think we're doing okay with right now? So that you're using your pediatrician can also be another great resource as well too.
Great. Another question here from our Facebook comments. And remember, if you have a question, you can leave it as a comment and we will try to address that in the next bit here. This person says, I work specifically with children with selective mutism. This is a challenging time of year for children and parents, hard to engage and speak. Any feedback to share on your experience with selective mutism, Dr. Heins?
Yes. Well, first of all, just I want to thank them because that it is a very it's an important role, and it also can be a role that requires a lot of patience and understanding, and truly taking the time to understand the function of the symptom in front of you is really important. So thank you for that support too that you're providing. In terms of our experiences with selective mutism, typically, I think I talked a little bit in the beginning about, trying to do work to the end goal, and the end goal being, what does the child see that they would like to be able to do, and what's getting in their way of being able to speak in, whether it's I can speak at home to a parent, but not everyone, or I'm not able to speak at all at home, but I can speak in school. What are the circumstances? And then from there, we can work on, okay, what is our goal? And what are the obstacles that are getting in the way of that goal? Because it can look a little bit different for each age range. Someone with maybe selective mutism at age 6 could look very different than 14. And so that will help us create kind of our roadmap of how do we progressively shape to being able to speak without it being an intense level of anxiety.
I love that you involve the student or child in the goal setting. And, it's
Absolutely.
not just what you want for your child, but what do they want to be able to do? And it makes them a
Absolutely.
problem solver along with you. Takes some of
Yeah,
the burden off, I'm sure. Um,
absolutely.
tell us a little bit about the cause of anxiety disorders. Sometimes as parents, we might say, "Did I do something wrong?" or "What? How do these come about?"
That's a good question. Many times it can be a couple different things, I guess. So there certainly can be a genetic or hereditary component, but just because perhaps if I have more anxiety in my side of the family, does that guarantee my child will? Not necessarily. But it's something to be aware of, certainly. Many times it can be a combination of environmental factors. Perhaps there is some predisposed anxiety, and then pairing that with some other environmental factors or stressors, it can be enough to ignite a concern, for example. that's usually what I guess we see most common is kind of that combination. Some can be solely environmental. I traditionally was able to, navigate through things, but then, COVID hit, or I, had a significant event happen that really, really kind of jerked me a little bit there. And so it's definitely had some residual anxiety follow after that.
Sure. Talk to us a little bit about the coexistence of an anxiety disorder with another mental health disorder. Do these sometimes go together, or
Yeah.
do kids usually just have one or the other?
No, I think absolutely they can very much feed each other, or reinforce each other. So for example, if I have ADHD, let's say, it's very common in ADHD to, perhaps have some hyperverbal moments, or maybe feeling a little bit more like I need to move around, or I can get a little bit more distracted at times. Or I could, I guess, unintentionally say something impulsively.
Mhm.
I thought I was trying to be funny, but perhaps that person didn't take it that way. So there can be some, as they reflect maybe later on after that interaction, maybe there was some anxiousness about, oh my, I hope they took it the right way. What if they didn't? And so anxiety can kind of, get reinforced with some of those worries there too.
Mhm.
Similarly with depression as well. What if worries can, or social anxiety can lead to avoidance of maybe social engagement, which could also increase my depression, because when we're isolating, we can tend to feel more, our mood is lower usually. So they absolutely can reinforce each other.
And again, as a parent, how do you navigate that? Is it important to encourage the child who may have anxiety to still get out there and do the things that are causing the anxiety to prevent depression, or what?
Yeah.
Where does this vicious cycle end?
I think it comes down to, being able to knowing and being comfortable talking about what those vulnerabilities are, because we all have them, right? So whether it's a formal anxiety disorder or not, or there's moments where we can feel down or anxious, or, experience an intense emotion. That's normal. And so knowing, for myself, like what are those kind of higher risk moments where I tend to get more anxious, or I tend to get down on myself, or how do I handle a setback? Knowing kind of how I navigate or don't navigate those things can be helpful, so that we can plan. Like, so if I know that school, changing, and it's a new teacher, I don't have my friends in my classroom, I could have some negative thoughts about that. They're not going to want to play with me, or, whatever it might be. We can
Hmm.
we can practice and proactively work around that. So I think it comes down to talking with your child, normalizing that we all have, thoughts that are happening throughout the day that we're navigating. And we want to give you some tools to be able to navigate as those thoughts come up, so that you see the thought and you can use the tool to move forward, versus seeing the thought and letting the thought kind of take us over.
So
Yeah.
you talked a little bit earlier about using that and technique
Hmm.
where I'm feeling, anxious about going riding the bus, and I'm gonna try it tomorrow or something,
Yeah.
whatever that would be. What's one other really solid tip that you would give people? You said there are lots of techniques. How do you challenge the thoughts and get people focused on something positive?
Yeah, I guess so. Outside of that one, I guess I also would look at, sometimes changing perspective. And, what would you say to a friend that was mentioning that they were worried about, whatever the example is that your child's talking about? What would you tell a friend if they came to you with this? And so trying to change perspective at times, can help a little bit, because most situations, not all, but most situations, they probably would be more likely to give the advice that you're looking for them to give to themselves. Um, if that's not how it plays out, you could also explore that still too, like, oh, that's interesting, that you would really want them to avoid this situation, and you can still explore that further.
Sure.
But I think perspective taking can help, because you can then come back to, well, that's really great advice. That makes sense why you would share that with them. What happens if we applied that to your situation? How is that different? Help me understand.
Mm,
You
I
know,
love it. I love it. Make them the problem solver there.
absolutely.
Um, Here's another good question that came in our comments. How long should we give a particular therapist before we begin to see progress? We've been seeing a therapist for the last 6 weeks and it doesn't seem to be helping at all. Is that enough time or what do you think? How would you?
Sure. I guess, depending on the age of the child too, each child's progress is really different, and so I guess I wouldn't judge it solely based on time per se. What I would say though is it's important that you and the therapist have an understanding of what are our goals. What are the goals that we're working towards, and how do we know that we're getting there. So being able to have an opportunity to talk with the therapist about how are we doing. So each therapist is a little bit different. Sometimes there's a portion of the session that they build in for me to be able to come in as a parent to with my child there, and we can practice together. Sometimes there's an opportunity for me to ask questions with my child outside of the therapy room, so I can ask more grown up questions. Sometimes they allow you to come in for a family session with the whole family. So each clinician is different, and so I would encourage communication with that therapist, if that wasn't clear in the beginning of what are we working towards and how we're doing and how am I going to know.
Yes.
So that will help you get that clearer roadmap and then make decisions from there.
So, in a nutshell, as we look at this whole big topic, it's the start of a school year. That can always hold some anxiety. What's that one nugget of advice you would give parents and schools working with kids in this time of extra stress and extra anxiety due to the pandemic?
Yeah, trying as much as we can to get excited about it. The more that we model the enthusiasm, the excitement, and focusing on the things that they're looking forward to versus our own what if worries. What if they forget their lunch? What if they forget?
Sure.
The more that we can focus on the excitement about a new year, meeting new friends, being able to learn new things, and growing up, and those I think tend to, if we're focused more on those things, our children can also sometimes follow suit. Not always that simple, but it certainly can help. So just
Right.
being aware of how what are we modeling in terms of our own and emotions and behavior, as we're getting our children ready. How are we doing with it? Is really
Ah,
helpful.
that's a great tip. So take care of yourself, moms and dads and
Yeah,
teachers. That self-care is so important.
it
Dr.
is.
Hines, this has been extremely valuable. We're grateful for your time and expertise. And thank you to all of you for really engaging and sending excellent questions. If we didn't get to your question or if you have additional questions on this topic, please use direct message. Um, to communicate with us, and we'll make sure that we get you a good answer. And also, for more information on mental health and addiction treatment at Rogers, you can always go to our website, Rogers B as in boy, H as in Harry.org, rogersbh.org/resources. Also, there are lots of videos and blogs and facts in that resources section. So we want to be a great resource to the community. And again, thank you so much for your time and attention. We just wish all of you the best as you get through this trying time and a new school year. Thanks again.
Thank you.